Hello everyone, my name is Nitesh and I'm working as a research officer in Edge Consultancy. Today I'm going to talk about COVID-19 floods and displacements, the trade of planetary health boundaries in South Sudan. Before I start, I would like to thank my co-author Dr. Sneha Krishnan for this study. So when we talk about South Sudan is a highly vulnerable country in the context of disasters because their coping capacity is very low. In such disasters like floods, COVID-19, displacements, food insecurities, infectious diseases, snake bites, and even conflicts, as the country is facing conflicts till 2011. In the year 2019 to 2021, the area is severely affected by continuous floods and that affected shelter, mobility, farming, fishing, and wash conditions in the South Sudan's two counties, Ayod and Fengak. People were facing problems in accessing their basic facilities such as toilets, markets, health facilities, etc. If we look at the first picture, we can clearly see that the whole area is submerged underwater, and how in the second picture we can see that how people are traveling from one place to another. For this study, our findings are such the Upper Nile area and Jongle state of the South Sudan, they were severely affected by floods, and that caused or that increased the displacement in the area. 67% of the resident and hosts and 11% of the respondents were displaced for less than 6 months, and 9% were displaced for more than 6 months, and 3.6% were returnees. Other than that, if we talk about the year 2020, in the first half of the year, 232,000 new displacements were recorded. Other than that, people use canons for travel purpose so that they can access their health facilities and basic facilities there. And in the fourth picture, we can see that how the shelters, how the shelter were properly damaged by floods. And other than that, the area is also facing COVID-19 that increased the hardship of the people there. And when we talk about the discussions, what are the discussions for this study? The study shows that thousands of people were displaced in the two counties due to floods and conflicts. Flooding affected 8 out of 10 states of the country. Other than that, we looked at the other research or reports also. According to ADB assessment report, 3,000 households were affected by floods. And the community members have been constantly displaced because of their circumstances as they are facing floods and COVID-19. And other than that, they have lack of food, lack of jobs, and they even have lack of shelters at that time. That affects or that increase the displacement process in the area. When we talk about the displacement, we can always say that better precautions for the flood situations and conflicts. We have to provide better precautions to the people so that they don't have to face uh, health facility they can access, or they can have they don't have to face health issues there. And humanitarian agencies can also restore the situations when we talk about this scenario, because they can always provide better resources so that people don't have to face hardship during these kinds of emergencies. Thank you so much. I guess I have only 5 minutes. Thank you so much. Thank you.